Hi, my name is Dr. Emily Splichal, functional podiatrist and human movement specialist. I want to speak to you today about flat feet in children. Now, something that parents are often told is that children with flat feet, don't worry about them, your child will grow out of it. Now, oftentimes that is true. However, understanding some of the exceptions to this is very important. Now, child anatomy and the way that their bones are aligned is continuously changing as they grow. We go from rotations inward to rotations outward. Our feet might be turning in and then our feet start to turn out. So what I want to do is review a couple aspects of the lower extremity alignment in a child and where I actually do recommend orthotics for flat feet in children. Now, if we look at the image here, what I want you to appreciate that is a common finding in children and contributes to flat feet is if we notice how the knees are coming inward. As the knees come inward, then it starts to deviate out. So it's almost like an X pattern alignment in the child legs. This is called genu-valgum. A layperson may say knock-knee, but the genu-valgum is a structural alignment of the hip, femur, and knee. Now what happens is as the knees come in, that starts to drop all of the body weight into the midline of the foot. That can start to create this rolling inward, which is overpronation or a type of flat foot. Now, oftentimes, depending on the severity, a child can start to build sufficient foot strength. Now, in a child like this, if they were starting to complain of foot fatigue, they start tripping over themselves, they continuously want to be carried by the parent, I may actually suggest orthotics for the child. Orthotics can be seen as something that helps to support the foundation through which the bones, ligaments, nerves, and tendons grow off of. So wearing orthotics in a child may be something temporary to set the rest of the body alignment. Now, another big exception of where you may want to consider orthotics for flat feet in children is when there is extreme ligament laxity. So if we look at the foot, you can see that there's a mild rolling inward. So it's like a collapse on the inside of the ankle. I would consider this mild. Now, if you notice even more rolling inward, there oftentimes is a ligament laxity component. I will often recommend orthotics for children overpronating with ligament laxity. If you have a child that has flat feet or you're concerned of flat feet or the potential flat feet in your child and want a consultation, please visit dremilysplichal.com.